Hey there, guys. Welcome to today's episode where we will be discussing the specialisms within dentistry, because dentistry doesn't just stop at being an associate and dealing with typical restorative work that you may have seen during your own work experience. Yes, of course, there's a lot more that you can do. And one of the greatest specialisms that we can actually go into is the oral maxillofacial surgery, which in itself is a mouthful to say. And that's why I've got our very special guest on today, who's not only experienced that, but has been willing enough to come on to give us the information. So let me go introduce you guys to Dr. Khalid. And Dr. Khalid, if you'd like to introduce yourself, give us a bit more of your background, and then we'll get into the questioning.
Thank you, Naveed. Thank you. It's great being with you today, and thank you for having me, actually. So welcome all to the podcast. My name is Khalid Abdul Jalil. As Naveed said, I'm an oral and maxillofacial and head and neck surgeon. It is a bit of a mouthful, but that's what I do for a living. It's a great specialty. I guess I'm sure we'll be talking about that as we go along. It is a specialty which historically has been based in dentistry, but it bridges dentistry and medicine, and is a fascinating specialty, actually. I encourage everyone who's interested to know more about it to find out a bit more about it. And, especially our young colleagues who are starting careers, encourage them to look into taking up this career.
Amazing stuff. I mean, before we kind of get into how one should pursue the career in itself, what does OMFS? I mean, we're going to use that abbreviation just to make the mouthful easier. What does it kind of entail? What do you guys cover? If there's a summarized version of that, and kind of what is a typical day-to-day look like?
So OMFS, as an abbreviation, is regarded as a surgical specialty in the UK and in many countries around the world. So it is one of the known surgical specialties. So the day-to-day work is surgical procedures around the face, the head, and the neck. Started in its roots in dentistry and in oral surgery, so surgery around the oral cavity, and then expanded outwards towards the face and the head and neck. The day-to-day work is like any other surgical specialism. Clinics, operating theatres, seeing patients. It's about handling patients and treating them, as a surgeon. So that's the day-to-day work.
Do you deal with some rather extraordinary cases as well? I know that there's everything from sort of the oncology side of things with cancers, all the way through to some very life-changing accidents that people have. Do you have any stories around that?
Absolutely, I have many stories. I mean, I could go on and on. We deal with trauma patients, we deal with cancer patients, we deal with patients with facial deformity, abnormalities, of the facial skeleton. We clearly deal with dental alveolar issues, oral surgical problems, a whole range of problems to do with the head and neck, the face, the oral cavity, and the neck. And that's what makes this specialty so special, I guess.
And like you've said something early on there as well, that it bridges the gap between medicine and dentistry. I get so many students that ask me, should I do medicine? Should I do dentistry? I'm really sitting on the fence with this. Are those the type of students that would really, really thrive in OMFS?
Potentially. I mean, I think the problem with people, students trying to think about getting into university is that contemplating an OMFS career might be a bit odd for them because of the need to have both medical and dental training. So when you're a 17 and 18-year-old contemplating going to university, you want to know what university degree and career you want to take up, but you don't want to be thinking about going to university twice. So it's a bit odd at that point.
Yeah,
that's not to say it's something you should not consider, but certainly if you start with either medicine or dentistry and you proceed with that and you find that you're into a surgical kind of mindset, and specifically in the head and neck, and you're interested in head and neck surgery, then that's certainly a career to consider, maxillofacial surgery.
And then what does that route look like then? So for anybody who's actually considering it, you've mentioned there the dual degree kind of process. What does it look like? How many years should it take? How competitive is it as well? Because I know for a fact that, I'm hearing weird stories. There's only 2 seats available per year. It's almost impossible. You've got to have so much experience behind you, but you've been through it all. So how about you tell us?
So in general, like any surgical specialty, this is a competitive field. Mm-hmm. I guess anyone who wants to be a surgeon has to recognize that they're letting themselves into, quite a competitive field. There are several surgical specialties nowadays, of which maxillofacial surgery is one of them. In principle, it is a competitive field. It is not as competitive as it used to be in the past, and as certainly not only 2 seats or only 2 vacancies a year. It's certainly more than and things have changed over the years. There are now more courses taking on graduate entry, candidates. There are more places. There are more medical schools, indeed, as you must know.
Yeah.
And indeed, probably more dental schools going forward. And this has changed, the competition and the entry difficulty into courses.
Right.
But it is a long career. Let's be very honest. It is a long career compared to any other discipline, because you have to study two undergraduate degrees and then have to have postgraduate training in both of these disciplines, medicine and dentistry. So by definition, it is a longer career. There is no getting around that. The career pathway has been shortened, and our association, our national association in the UK and in other countries, has been looking at trying to shorten these pathways, knowing that long careers, put off people. It's not the best. It's not the best thing to consider when you're a teenager.
Yeah.
But the career is the training is getting shorter. I believe.
So say, for example, somebody was to embark on that journey, like we're speaking in 2024, they were starting their dental university career as of September, right? And that's 5 years. Would they then need to complete the, foundation year, or can they go straight into then another 5 years of medicine, or is it shortened? In your experience, how does that kind of work?
So they would certainly need to complete their foundation training.
Okay.
But then there's a rapid, if you can call it, an expedited entry route, where you then have to consider obviously going to medical school, and then after that go into specialty training. The training pathways are changing year by year, and the entry routes are changing every year. So foundation training after medicine, that's if you do medicine first, is required. A lot of people obviously start with the dental route and then go on to do the medical route, and then likewise have to do foundation after medicine. Or vice versa. So you'd have to do 2 degrees, but the second degree usually is a shortened degree. Yeah.
Okay.
Accepting that if you're a medic, your dental degree will be shortened, and vice versa.
Because you've kind of covered most of the first preclinical years, right? So I understand there's a bit of a merge between the two. And then when you're kind of out there in the open, you've done your specialty training. What does the world look like then for oral maxillofacial surgeons? Is it very much a clear-cut pathway, or are there specialisms within the specialism?
There are indeed. Like most surgical disciplines, you then choose your track. So there is an oncology and reconstruction pathway. There is a facial deformity pathway. There are other subspecialties. So indeed, there are specialisms within the specialism. And actually, the way things are going forward is that you qualify after your 5 years of higher training as a specialist, as a generalist, generalist or a surgeon. And then again, there is a move to do fellowships to specialize in head and neck oncology, or fellowships in cleft, lip, and palate, fellowship in craniofacial surgery. So there are specialisms, but there's a whole lot of generalists, a lot of generalists who will do a lot of the work, and even then it's a busy specialty.
I'm with you. And then yourself, what was been sort of your journey then through when you hit that OMFS title? Did you specialize? Did you kind of go through one channel, and how did you figure that out for yourself, like where you wanted to be?
So I mean, during my higher training, you mean during my specialist registrar training?
Yeah, and then beyond, yeah.
And so during my specialist training, which was quite a while ago, actually, I chose to go down the head and neck oncology and reconstruction route.
Nice.
And so my last 2 years were basically focused on that before taking my exit exam, my specializing exam. And then after finishing my training, getting my certificate of completion of training, I actually did a couple of fellowships. One was a facial cosmetics and reconstruction fellowship in the UK. It's called the Interface Group higher specialist fellowships, which still run actually. So I did that, and then I did a subsequent sort of mini fellowship abroad in the US, again in head and neck oncology and reconstruction, just to hone in my skills for oncology and reconstruction before taking my first consultant job. And those were very, very useful actually, looking back, for my subspecialism. And they stood me in good stand until now actually.
That's amazing stuff. I think getting this insight from you, from someone who's been there and done that, is very important. And usually people get lost sometimes as to what route to take and what information and resources to use. So having you say that those kind of things are very useful is helpful for anybody listening. And I think one thing that I've recently come across, just to kind of segue into more surgery as a whole, not just OMFS, right? We had a teacher in one of our classes that said she's a surgeon and teacher, part-time job kind of thing. She told us that being a surgeon at any level requires a certain personality, right? So it's not for everybody. She even said it's almost, I'm not saying this is her words, but it's almost for people that have huge egos. So what would you say to that? And second of all, what would you say is an ideal personality or characteristics that people should have if they wanted to pursue surgery as a whole, or even more specially speaking, OMFS?
I mean, I think that there's this thing about surgeons being very egotistical. This thing about ego. There certainly is that view, but that certainly is not the case with every surgeon I know. Don't get me wrong. There are a lot of surgeons who really push their ego, but that's not the case with every surgeon you have to meet. You do have to be clear in your views. Let's face it, you're sometimes dealing with some very critical patients, with some very tough decision making. You have to guide your patients. You have to be the advocate for your patients. So you have to be very clear in your approach, in your daily work. That doesn't mean you have to be full of ego. There are other attributes I certainly would say that every surgeon should have. They should be, as I said, very resilient, very flexible, very approachable, and empathetic, I guess, would be one thing that they have to be with their patients, especially when they're working in things like oncology and cancer and patients with severe trauma and so on. Timekeeping, knowing what you want, focused, target oriented. A lot of things you have to be as a surgeon, and I guess that comes with any medical or dental professional specialism.
Of course, and one thing that you mentioned there is having empathy, right? And I think one of the issues that maybe, or perceptions that we have of surgeons, maybe not so much OMFS, but is we feel as though you're kind of detached from patients, that you just get given someone, they're sitting on a bed in an operating theatre, you work on them while they're sedated, and then that's it. They never see you, you never see them, and that's pretty much how it works. But you're mentioning there that empathy is a very strong attribute that people should have. So what's the interaction with patients like for somebody at your level?
Well, it's a daily thing, and in fact, I can't stress that more. As a surgeon, certainly when you're working with any form of complex surgery or reconstruction, your patients, become like family, to be honest. Only this week this has been a particularly busy week for me. My weeks are generally busy, but this week has been a particularly busy week. I'm on duty. I'm covering trauma and emergencies, and I've had a very solid, busy week dealing not just with patients, but with their immediate family, with their extended family. I've had a few patients who were involved in some horrific car accidents, ended up with some horrible facial injuries. I've had a gentleman who's had major head and neck surgery a few days ago, and in fact has had a complication, post-operative complication. And only today I had to take him back to the operating theatre to deal with that complication.
Oh my!
With the team. I mean, the benefit I have, and I guess any surgeon has, is this is not a one-person effort. This is a team effort. And I guess if you have a good team, then you have good results and you have happy patients. So I'm really blessed to have a good team, and that's where things work out very well and in your favor as a surgeon when you're dealing with complexity and you're dealing with difficult decision making and so on. So a good team really does make or break your
I think I think you've answered one of my upcoming questions, which was, how solo is the job? Can it get depressing? Because, is it a case of you're on your own? But you've answered that so well that it does rely on the team. And I guess with that, then you build a relationship outside of your own home, right? So you've got a family outside of the home, be that with your team or with your patients, as you quite rightly said. And this is something that people, I think, including myself, can sometimes be, get the misinterpretation of what surgery is like, that it's very cold, calculated, it's very singular mindset, and you've got to have thick skin to do it, because if you don't, then you're going to be in a very dark place. But having a good social circle around you and building off of your patients and your team, it's amazing to hear that that's actually the truth of how OMFS works. So I guess one of the attributes we could say for somebody who wants to pursue this is to be a team player, right?
Absolutely, absolutely. This is a team effort, and so is every, medical specialism these days. To be honest, medicine is getting more and more complex. Healthcare is getting more and more complex. If you think about it, the technology, all the supportive services, the allied disciplines that we work with, it's a big team that you work with, and they are your second family, certainly for me, and they do help me. And I'm, as I say, I had to take a patient back to the operating room today. It was a team effort that made that return to the operating theater a success. I take some of the credit for that, but I certainly cannot take all of the credit. It is a team effort. And I guess this is one of the nice things about OMFS. In dentistry, sometimes you can be isolated if you're in your own practice, sitting in your own, clinic or practice, maybe with a dental assistant or a dental nurse, day in, day out. That can be sometimes a bit, I don't know, isolated. But the beauty of surgery in a hospital setting is where, big team, becomes just, enjoy your work. And that's where they say, you enjoy your work, it doesn't become work. It just becomes a hobby, becomes something nice.
I like that. I like the way you put that. And I think that you've definitely made OMFS sound a lot more warm than maybe we in our small experience have felt otherwise. So thank you for shedding light on that. And obviously now you're no longer working currently in the UK. So would you like to give us a bit more insight as to where you are now and how that transition took place?
Yeah, so I obviously trained in the UK and did work in the UK for a consultant for a number of years before moving to the United Arab Emirates. Now I'm based in the United Arab Emirates, in the Emirate of Abu Dhabi. Obviously, that's in the Middle East, in the Gulf region. A totally different setting to the United Kingdom, totally different healthcare system. It's more akin to the United States, to the American healthcare system, in terms of how the system is run, the financial compensation, the insurance-based system, as opposed to our National Health Service in the UK. So it's a very different setup. And nevertheless, it's a healthcare system, comes with its own challenges, has its own, upside and advantages. And yeah, I enjoy it here. I made the move a number of years ago. And I really enjoy my current setting. There were definitely challenges moving from the NHS to the Gulf region. But I'm a person who, as a surgeon, like most surgeons, enjoys challenges, and that was something that I really embraced. I took on, and I'm glad to say that my team now and colleagues I work with, I'm really proud of, and it's I enjoy it, and I'd like to think I'm making a change to the local healthcare setting, and I'm really fond of my NHS setting and training, and it's really put me in a good position to come and serve the people of the UAE.
That's amazing stuff. I think a lot of us out there want to know, is there life for associate dentists who may not have specialty training to actually find work in the UAE, or is it now oversubscribed? Is it quite saturated for those kind of dentists? I know so many people, including myself, have always had that in the back of the head, I want to live in a tax-free haven, earn money, and have the weather to go with it and the city and all the rest of it. Would you say that it's a case of, if you want to pursue that side of things and move abroad, it's good to have some form of specialty training beforehand? Or is there actually a chance for people who just want to qualify, work as an associate dentist for a couple of years, take that experience and go over?
I think looking at the local healthcare sector, I think having some form of specialism or extra training would certainly make you in a better position to find a post somewhere out here. If you're a new graduate or if you come here with very limited experience, I think you would struggle to find any form of work. Dentistry in particular is quite saturated in most places, actually, not just here. I would imagine in most places around the globe. But certainly, if you're specialized or have some form of extra training or higher degrees, that will certainly put you in a much better position of finding work.
Amazing stuff. And then kind of just to wrap it up, Doc, what would be your advice to students in general, aspiring dentists, newly qualified people that are considering OMFS as a future? What's kind of that last bit of advice you'd like to give them to keep them motivated to hopefully be in the same seat as you in the near future?
I mean, I'm biased. I'm an OMFS surgeon, but I always, whenever I see somebody considering, let's say, just considering the idea of going to OMFS, I encourage them to just keep that in the back of their mind. And at any stage, before starting dental school, after dental school, I get a lot of inquiries from colleagues who qualified, who are considering OMFS. And at any stage, I encourage colleagues to just keep it in their mind, ignore the fact that it's, as much as they can anyway, that it's a long career pathway. It's a lot shorter now than it used to be when I trained. So just ignore that, or at least put that to one side. Consider the benefits of working in a great specialty. It's a relatively small specialty. There aren't many of us around, actually. In the UK, I think when I left the UK, the number of consultants was in the region of 150 consultants.
Wow.
The entire United Kingdom. It's a small specialty. It's really fascinating. You're part of a small group of people providing great care, and you're well respected by colleagues across the spectrum of medical disciplines. People look at maxillofacial surgeons and really respect the way they are trained, respect the way they practice and their ethos and so on. So I always tell colleagues to just keep it in their mind, ask for advice. There are people around who, like me, who happily give advice if you're interested and guide you through your career. It is a discipline, that you can do after dentistry or after medicine. But certainly encourage people to keep it in their mind and ask for advice if they want to. There are plenty of people who will give that advice happily.
Amazing. And you've been very forthcoming with me as well when I reached out to you. So I've got to back that up and say that Dr. Khalid is actually a very, very warm person to get in touch with, very insightful. And I think one other thing, if I can ask from a personal level right now, before we log off, what could an OMFS, so an oral maxillofacial surgeon in the UK on the NHS, what can they look forward to earning? Because earning, let's be fair, like we all majority of us work to live, let's call it, and salary is an important thing. What's the range? I'm not going to talk specific, but what's the range?
So for the consultants, you mean, for consultants pay? Again, I've been out of the UK for some years now, but the consultant salary goes up to over 100,000 per annum. £100,000. This was a few years ago, and I believe the contracts and the pay has been negotiated recently. So that has actually gone up. So I'm sure it's over £100,000 per annum. So it's a good salary. It's not all about the pay, obviously,
of course,
but it's a good salary, and there are avenues to do private practice to increase your income. You can work in independent hospitals to increase your income if you want to. There are colleagues who work fully in the private sector, not in the National Health Service. There are other avenues that you can look into, and of course, there's always the option to go abroad and have work in other healthcare sectors. I know a lot of colleagues who've crossed the Atlantic onto the US, colleagues who've gone down under to Australia, to New Zealand, increasing number of people coming here to the Middle East. So there are other options, having said that. But clearly the NHS is the first ground where you'll be working as a consultant.
Great place to be. And Doc, if anybody wanted to get in touch with you, how could they go about doing that? Or if there's any links to any websites that you'd like them to check out, now's your time to shine.
So I'm very into social media. I have a social media presence, but from a professional perspective, I use my LinkedIn account. I have an active LinkedIn account. I think you've seen it. That's where we make contact. and people can reach out to me through that. I actually post a lot of my work and professional stuff on that account. I also have a active YouTube account where I post again a lot of my surgical cases.
Yep.
And people can reach out to me through either of those or through my email. I'll happily share my email with you. I'm available and approachable.
And I'll do my bit, and I'll put all of those links into the description box below. So before we sign off, just anybody who is listening or watching, I hope you've taken as much insight from this as I have. And it's been an absolute pleasure recording this with Dr. Khalid. So I just wanted to say, Doc, thank you so much for joining us today. And I'm sure that we have all enjoyed it. Hopefully, we'll do another catch-up video in the near future.
Thank you very much, Nabi. It's been a pleasure talking to you, and I'm very grateful for that.
Thank you so much. See you guys on the next one. Bye-bye.